Hello, Professor Angela. My name is Taiwo, a student of Grand Canyon University with student ID 207-29762. I'm here to talk about my project presentation for the course NUR 674 Leadership in Healthcare System Practicum. Now to the presentation. The site and problem identification. My project was done in St. Elmhurst Hospital, which is also known as Edward Elmhurst Hospital. And during my course of stay, I discovered that 1 in every 2 patients is hypertensive. There is prevalence and very high number of people that come into the hospital with hypertension or hypertension-related complications. Hence, the problem was identified because there is need for improving the quality of care of the patients on the site. Now to the topic. Lengthy discussion showed the need for improved effective leadership in the department. There is also a need for leader to guide the caregivers, the provider on providing quality care, and thus the project topic, assessing the role of effective leadership in enhancing safety standards for high blood pressure in the hospitals. The goal of the project was to determine the role of effective leadership in enhancing safety standards for high blood pressure patients in the hospital. And this is to say that the project called Target BP, this is educating the patient on the importance of recording and reporting very high blood pressure to their physician. And they are also educated on the importance of owning a home blood pressure apparatus in order to take their blood pressure, record the trend, report when it's too high, and when it's over the roof, to go to the ER. They should know when to report to the physician through My Chart app, which is a patient-doctor communication app. And they should also know, based on the number, when to go directly to the ER to seek immediate help. And also educating them on the importance of checking their diet to make sure it's low sodium, exercising regularly, choosing low sodium options, drinking water, having a very active lifestyle by exercising, especially when their lifestyle is very sedentary. The project outcome were to improve the quality of life of patients with high blood pressure at St. Edward Hospital. That is eliminating high blood pressure related complications such as heart attack and stroke and other cardiovascular diseases that comes from high blood pressure. And this is to say that when patients do all these things as educated, and while they are on admission, when the nurses, the providers do their blood pressure and it's high, we're reinstating the importance of checking and rechecking blood pressure when it's high and taking appropriate steps to treat the symptoms before complications sets in, which also include blindness. Stakeholders' responses. The project proposal was made to the hospital stakeholders, and this include the hospital leaders, the nurse leaders, the head clinicians, and positive response was received from this team on the importance of following up with this project. The management representative applauded the project. The manager accepted the project, claiming it would improve the face of the organization, and nurse leader also approved the project. Everybody were on board with the project as it is something that is so common and very often missed and mismanaged. Sustaining the project. The project will be sustained through frequent leaders training to guide them on solving different healthcare issues. The importance of continuous education cannot be overemphasized in sustaining this project, because nurses have so much going on. Take, for example, the med-surg floor, where there's heavy workload on the nurses and the nursing assistant. So it is imperative that the leadership constantly remind, constantly educate, constantly teach, constantly have hands-on practices on how to effectively take blood pressure and how to report them. Also, constantly reminding the patient, because everything we do is about the patient, constantly reminding the patient and having them follow up on their blood pressure at every, and 4 to 6 weeks is recommended, or when it's too high, should be reported within 5 days. And when it's skyrocketed, like for example, having a blood pressure of 200 over 170, then at that point the patient is encouraged to report to go to the nearest ER to get help. So it is important that we sustain this project through all this aforementioned ways. Lessons I learned from this project. This project helped me improve my leadership skills in multiple ways, which includes my preceptor giving me access to, and she gave me access, and she worked with me in going through doctors and nurses practitioners notes that had been written about the patient, to ensure that they are doing what they are supposed to do. That is, recording blood pressure, retaking when it's high, educating the patient, adding medication, adjusting medication as appropriate. This gave me confidence that I could, and because after the audit, I was able to talk to the doctors and to the nurses as to how they can improve, and this gave me confidence that I am doing something right as a leader. Also, it enabled me to use my power of influence. It also taught me the benefits of servant leadership in guiding nurses. That is to say, leading and guiding by example, and encouraging as much as possible to make sure the nurses were doing the right thing, and the providers as well. The project also taught me the importance of humility. I learned that effective leadership determines the quality of care provided in a hospital. I also learned the importance of quality assurance and leadership, in order to make sure that from time to time the nurses, the providers are being checked to make sure they were doing what they are supposed to do. I would like to use this medium to say a very big thank you to you for listening to this video, and to also appreciate your time for the past 15 weeks, and also to thank my preceptor for being a listener and a true guide. Thank you so much for listening.